Have you ever had an itch that just wouldn't quit? That maddening, relentless sensation that distracts you during the day and maybe even keeps you awake at night? We've all experienced itchy skin, a pesky mosquito bite, a reaction to a new soap, or just that dryness that comes with certain seasons. Most of the time, it's just an annoyance. But what if that persistent itch, the one that lingers for weeks or even months, especially in certain areas, is trying to tell you something more? Could your skin, our body's largest organ, be sending out a subtle warning signal about something happening underneath the surface? Is it possible that some itching is more than just skin deep? Hello and welcome. In this video, we're going to talk about a topic that affects many of us as we age: persistent itching. While often harmless, there are three specific types of ongoing itchiness, particularly noticeable in specific areas of the body in older adults. Today, we'll explore what these three specific itchy warning signs are, focusing on the lower legs, the anal or perianal area, and generalized itching without an obvious rash. What these different types of itching might mean, looking at both the potentially serious underlying causes and the more common, less concerning reasons. And most importantly, we'll discuss clear signs that tell you when it's crucial to stop guessing and seek professional medical advice, along with some general tips for managing itchy skin. Remember, the goal here isn't to cause alarm, but to empower you with knowledge so you can be proactive about your health. Let's dive in. Let's begin with a very common sight for persistent itching as we get older: the lower legs. We're not talking about a fleeting itch after shaving or from dry winter air, but an itch that feels deep, persistent, maybe even burning, and often seems worse at night. Sometimes, this itchiness is accompanied by noticeable changes in the skin itself. It might look unusually dry, flaky, scaly, perhaps even discolored, reddish-brown or purplish, or feel tight and thin. In some cases, persistent lower leg itching can be linked to poor circulation. Conditions like peripheral artery disease (PAD), where arteries supplying blood to the legs narrow, can reduce blood flow. When your skin doesn't get enough oxygen and nutrients, it can become dry, fragile, and intensely itchy. This is more than just a skin issue. PAD is a cardiovascular concern that needs proper management. Another significant potential cause, especially if you have diabetes, is nerve damage, known as diabetic neuropathy. High blood sugar over time can damage the nerves in your legs and feet. These damaged nerves can send faulty signals to your brain, which might be interpreted as itching, burning, tingling, or numbness, even when there's no external irritation. Managing blood sugar effectively is key here. Less commonly, but still possible, certain thyroid disorders, both an underactive hypothyroidism or overactive hyperthyroidism thyroid. So, how do you differentiate? When should that lower leg itch prompt a doctor's visit? Pay attention if the itching is severe and persistent for weeks despite using moisturizers, accompanied by significant skin discoloration, darkening, redness, purplish hues, associated with swelling in your legs or ankles that doesn't resolve easily, happening alongside pain, cramping in your calves when walking, claudication, or a feeling of coldness in your feet. If you notice any sores or ulcers that are slow to heal or not healing at all, or if you experience numbness, tingling, or burning sensations. If you're experiencing simple dry skin, consistent moisturizing is key. Look for thick creams or ointments containing ingredients like ceramides, hyaluronic acid, or petrolatum. Use mild, fragrance-free soaps and avoid very hot baths or showers which strip natural oils. Pat skin dry gently instead of rubbing. Elevating your legs when resting can help with swelling related to vein issues. However, if you have any of the red flag symptoms we discussed, or if the itching is severe and unrelenting, It's essential. Next, we'll address a topic that can be uncomfortable to discuss, but is important for health awareness: persistent itching around the anus or the perianal area. This condition, medically known as Pruritus Ani, can be incredibly intense, often worse after a bowel movement, or particularly bothersome at night, significantly impacting sleep and quality of life. Understandably, it can also be quite embarrassing. What might be causing this persistent discomfort? While thankfully rare, persistent, unexplained pruritus ani can occasionally be a symptom of more serious issues like colorectal or anal cancer. This isn't the most common cause by far, but it's why persistent symptoms, especially if accompanied by other changes, shouldn't be ignored. The itching might arise from local irritation caused by the tumor itself or the body's inflammatory response. Certain inflammatory bowel diseases, IBD, like Crohn's disease, can also sometimes manifest with perianal symptoms, including itching due to chronic inflammation in the area. Much more commonly, however, persistent anal itching alone often warrants a doctor's visit due to the discomfort, but definitely seek medical attention promptly if the itching is accompanied by rectal bleeding beyond a tiny speck on toilet paper occasionally, significant pain in the anal area, any noticeable change in your bowel habits, like persistent diarrhea, constipation, narrowing of stools, that lasts more than a couple of weeks. Unexplained weight loss, a lump or mass you can feel in the area. Pus-like discharge. For managing less severe causes, focus on gentle hygiene. Clean the area with plain water or a very mild, unscented soap after bowel movements, and pat dry gently with a soft towel. Don't rub. Wear loose-fitting cotton underwear and avoid tight clothing that traps moisture. Try to identify and avoid potential irritants like certain foods, harsh soaps, or scented wipes. Increasing fiber and water intake can help prevent constipation and straining, which worsen hemorrhoids and fissures. Over-the-counter creams with hydrocortisone can provide temporary relief for inflammation. Our third area of focus is perhaps the most perplexing, and potentially the most concerning if it persists: generalized itching. What we mean by this is an itchy sensation that isn't confined to one specific spot like the lower legs or around the anus, but rather occurs widely, perhaps even feeling like it's all over your body. A key feature that makes this type of itching particularly noteworthy is that often there's no visible rash, bumps, hives, or obvious skin irritation to explain it, at least not initially. Of course, constant scratching can eventually lead to redness, marks, or even broken skin. But the initial problem is the widespread itch itself on seemingly normal-looking skin. This sensation can vary greatly from person to person. For some, it might be a mild but constant, annoying background noise, a low-level itch that's always there. For others, it can be severe, intense, and come in waves. Sometimes, when you have this kind of persistent, widespread itching without an obvious skin condition causing it, doctors refer to this as systemic pruritus. The word systemic is key. It strongly suggests the cause isn't originating on the skin itself, but rather stems from an underlying issue within the body. Think of it like an internal alarm system going off, and the itch is the signal being reflected through your nerves or substances circulating in your bloodstream that reach the skin. So, what internal conditions could trigger such a widespread, persistent itch on otherwise normal-looking skin? Several possibilities need to be considered, which is why a medical evaluation is so important. Liver disease. This is a well-known cause. When the liver isn't functioning properly, due to conditions like hepatitis, cirrhosis, or bile duct obstruction, it can struggle to process bile salts. These substances can then build up in the bloodstream and deposit in the skin. These bile salts are known irritants to nerve endings in the skin, triggering a very intense and often difficult to treat itch. While jaundice, chronic kidney disease, CKD, Kidney failure. This is another significant potential cause, often referred to as uremic pruritus. Healthy kidneys act as filters, removing waste products from the blood. When kidney function declines significantly, waste products like urea, phosphate, and other toxins accumulate in the bloodstream. These substances circulate throughout the body and can trigger widespread, often severe itching. This itch can be particularly intense and may worsen during or after dialysis treatments in those undergoing them. Other symptoms of advancing kidney disease can include fatigue, swelling, edema, changes in urination patterns, more or less frequent, nausea, loss of appetite, and shortness of breath. Because this type of generalized itching without an initial rash can be a signpost for such a diverse range of internal conditions. From the relatively common, like medication side effects or severe dry skin, which we'll touch on shortly, to the potentially serious ones we've just discussed, it absolutely warrants a thorough investigation by a healthcare professional. Self-diagnosing is not advisable here. Getting the right diagnosis through a proper medical history, physical examination, and targeted blood tests is the essential first step towards effective management and addressing any underlying health concerns. Before jumping to serious conclusions, it's vital to know that generalized itching without a rash also has common, less alarming causes. Medication side effects are a huge one. Many common drugs, including some blood pressure medications, cholesterol-lowering statins, pain relievers like opioids, and even some antibiotics, can list itching as a potential side effect. Severe generalized dry skin, xerosis, can also cause widespread itching without a prominent rash initially. Stress and anxiety can manifest physically, and psychogenic itching is a real phenomenon. Less frequently, certain neurological conditions can cause itching sensations. When should generalized itching without a rash raise a red flag? Seek medical evaluation if the itching is severe, persistent, and significantly impacting your quality of life, accompanied by unexplained fatigue that isn't relieved by rest, associated with unexplained weight loss. If you experience drenching night sweats, soaking your pajamas or bedding, accompanied by a persistent low-grade fever. If you notice yellowing of your skin or the whites of your eyes, jaundice. If you find any new persistent, because generalized itching without a rash can point to so many different internal possibilities, a thorough medical evaluation is absolutely crucial. Your doctor will likely ask detailed questions about your symptoms, medical history, and all medications and supplements you take. They will perform a physical examination, paying attention to lymph nodes, liver, and spleen, and will almost certainly order blood tests. These tests can check your liver function, kidney function, thyroid hormone levels, blood counts for anemia or signs of leukemia, lymphoma, iron levels, and sometimes other specific markers. It's incredibly important to provide your doctor with a complete list of everything you take, including over-the-counter drugs and herbal supplements, as these can sometimes be the culprit. Don't stop any prescribed medication without talking to your doctor, but do discuss the possibility that a medication could be causing the itch. So, we've covered 3 potentially concerning types of itching. But let's take a breath and reinforce this. The vast majority of itching experienced by seniors is not a sign of a serious underlying disease. Everyday culprits like dry skin, especially in winter or dry climates, allergic reactions to foods, pollen, detergents, insect bites, or simple skin irritation from clothing or chemicals are far more common. These usually present differently. They often involve a visible rash, hives, redness, or specific bite marks. They tend to be more temporary, resolving when the trigger is removed or with simple treatments. They typically respond well to over-the-counter remedies like antihistamines or basic hydrocortisone creams. The warning sign itching we've discussed today tends to be persistent, lasting for weeks or months without a clear cause. Severe, significantly disrupting sleep or daily activities. Unexplained, no obvious external trigger or rash, especially in the generalized type. Resistant, doesn't improve much with standard moisturizers or OTC creams. Accompanied by other symptoms, like those red flags we mentioned: weight loss, fatigue, fever, night sweats, bleeding, jaundice, swollen glands, etc. The key is pattern recognition and paying attention to your whole body, not just the itch itself. While specific treatments depend on the underlying cause, some general habits can promote overall skin health and potentially reduce dryness-related itching. Stay well hydrated. Drink plenty of water throughout the day. Moisturize regularly, especially after bathing, using a thick, fragrance-free moisturizer. Bathe wisely. Use lukewarm, not hot, water and limit bath shower time. Choose mild, non-soap cleansers. Wear comfortable clothing. Opt for loose-fitting clothes made from soft, natural fibers like cotton. Manage stress. Chronic stress can worsen itching. Find healthy coping mechanisms like gentle exercise, meditation, or hobbies you enjoy. Remember, these are supportive measures. They won't cure an underlying systemic disease, but they can help maintain skin barrier health. To wrap up, persistent itching, especially in the lower legs, the perianal area, or occurring generally without a rash, can sometimes be your body's way of signaling an underlying health issue that needs attention. While common causes like dry skin are frequent, it's crucial not to dismiss an itch that is severe, lasts for weeks or months, doesn't respond to simple measures, or comes with other concerning symptoms like unexplained weight loss, fatigue, fever, night sweats, bleeding, or jaundice. Thank you so much for watching today. I hope this information has been helpful and empowering. If you found value in this video, please give it a thumbs up and consider sharing it with friends or family members who might benefit from this knowledge. For more health insights and tips focused on navigating aging gracefully and healthily, please subscribe to our channel and click the notification bell so you don't miss future updates. If you have general questions this video sparked, not personal medical queries, please, feel free to leave them in the comments below. It helps us know what topics are important to you. Take care of yourselves, listen to your body, and I'll see you in the next video.